Dr. Bedelia, credibility is a tricky thing, and it's just about everything in your line of work. You didn't have to be a board-certified physician to watch the president's physician on television, especially during his hospitalization, and have questions about, was the doctor co-opted by the patient? Why couldn't we know the answers to certain questions? So the timing was a tad suspicious today when the president was en route to his first public rally following his hospitalization, after all, and we were told, oh, yeah, he tested negative. First of all, Doc, do you believe the results?
Good evening, Brian. When I looked at that letter, what it said to me was that the president is still PCR positive, because if he was PCR negative, the genetic test that we use to see if someone's shedding a virus, they would have said so. They would have said he's had 2 negative PCR tests, which is part of the CDC clearance from public health isolation for people who were severely ill, unless they're indoors for 20 days, which is the other requirement. The way the letter is crafted, so what it says is it clearly is positive. And what we're doing is, what the White House medical team is doing is looking at the amount of virus, and they're saying the virus is very low, but they're not telling us how low that virus is. And they're using, more advanced technologies. They're generally more used in research. And so we don't know how they correlate with widespread use in terms of getting a sense of someone's infectiousness, which is the subgenomic RNA that they're talking about. But I think the thing that just is a farce to me is the Binax, the antigen test that they quote, because the FDA itself says that the test should not be used in those who are more than 7 days out of their illness, because in those that test it generally needs to be validated with a PCR test, because it could be negative because it's not as sensitive. So really the purpose of that letter is less of a medical letter and more of a political letter that creates this veneer of this is the reason where it's okay for the president to now leave public health isolation and go on to hosting these future, super spreader events where, other folks may be gathering without masks. So even if the president's not bringing the virus to the party, there might be others who may be continuing to transmit this disease as we enter, again, a second week of high hospitalizations, not just cases, but hospitalizations from COVID-19.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.